Hello everyone, welcome back to the channel. And so today's video I'll be talking about the thyroid function testing. So what do they mean and how do you understand about the thyroid testing? So the thyroid testing mainly involves a thyroid function testing and tests related to thyroid antibodies. So the thyroid function testing is mainly the testing for the TSH, T4 and T3, and then we may do tests for the thyroid antibodies. So the thyroid function testing helps us to understand the level of the thyroid hormones in your body, the status of the thyroid function. And the thyroid antibodies testing helps us to understand the cause for any thyroid abnormality and helps us to decide the long-term prognosis related to the tablets and the condition. So the thyroid function testing, most common tests used are the TSH, T4 and T3. So TSH is the thyroid stimulating hormone. So you must remember that TSH is not the thyroid hormone. It is a stimulating hormone produced from the pituitary gland, which controls your thyroid gland. The actual thyroid hormones are the T4 and the T3. So TSH is usually the first test we do to detect any abnormality in the thyroid gland. Why is this the first test? Because TSH is a very sensitive test for the thyroid function. That is, TSH becomes abnormal even when there are very mild abnormalities in your thyroid hormone. So we can detect any abnormalities in the thyroid hormone status even at a very early stage, even when there are no symptoms. So that is why the TSH is the first test we do. Now, the important thing that you must know is that the TSH and the T4 and T3 have a inverse relation. That is, it is controlled by a negative feedback relation. That means that the TSH will be high whenever the actual thyroid hormones, the T4 and T3, are inadequate or low in your body. So when your TSH is high, it means that your thyroid hormones are low or you have a hypothyroidism. So this is very important to remember, because most of the patients I see, when they see a report of TSH being high, whether it's 10, 15 or 20, they think that their thyroid hormones are more. But this is actually the opposite. When the TSH is high, it means that the thyroid hormones are actually less in your body. And again, it's the same. Again, if your TSH is very low, it is less than the normal limit, it's less than 0.4, then it indicates that the thyroid function is more, or the amount of hormones in your body is high. So after doing the test for TSH, usually your doctor will order for further tests including T4 and T3, or they may also test for the antibodies. So if you're already on treatment for a thyroid, that is, you're already taking thyroxine tablets for a hypothyroidism, then again it is important to understand the variations in the TSH. So if you're already on the tablets for thyroid and if your TSH is high, it means that the dose of thyroxine that you're taking is inadequate for your body. So TSH is basically reflects the level of the hormones in your body, whether it's the thyroid hormone produced from your thyroid gland or whether it's the hormones that you're taking as a tablet. So when the TSH is high, it means that the dose of the tablet that you're taking is probably little less for you, and you must consult your doctor. And similarly, when you're taking the tablets and if the level of TSH is very low, it means that the dose you're taking is a little high for you and the dose needs to be adjusted by your doctor or endocrinologist. So now, what are these antibodies? So antibodies are an indicator of an autoimmune process. So autoimmune process means that our body starts to react against our own organs. That is, the body starts producing antibodies against certain antigens in our own organs. So thyroid autoimmunity is very, very common. So antibodies are formed against mainly two thyroid antigens, that is the thyroglobulin and a thyroid peroxidase, which is an enzyme in the thyroid gland. So these two antibodies are most often monitored or measured whenever there is any abnormality in the TSH or T4 and T3. So what does this mean actually? What does the level of antibody mean? What is the significance? So important thing for you to remember is that the actual level of the antibodies does not have much significance. So it's very common that you may have seen that the reports of your antibodies are very high. You may have an anti-thyroid peroxidase of 1,000 and patients get very worried. Of course, when you see that the normal level is less than 35 and your level is more than 1,000, it's natural for you to get worried. But the actual level of the antibodies does not have much significance, whether it's 60 or whether it's 1,000. It only is an indicator that there is an autoimmune process going on. And when the antibodies are high, it just means that this is going to be a long-term treatment that you require, and you should not stop the thyroid tablets. You must remember that the antibody itself does not cause any symptoms, or it does not cause any harm to any other organs. So once the antibody is high, it usually remains high for many years, and it may reduce gradually over 5 or 10 years or longer, but it does not have much relevance later. You must understand that the treatment for you is not towards the antibody, but the treatment is to normalize your TSH, that is the thyroid stimulating hormone, so that you have normal levels of hormone in your body. There is another antibody that is called as a TSH receptor stimulating antibody. So this antibody acts slightly differently. It stimulates your thyroid gland to produce more hormone. So this antibody is very specific for a condition called as Graves' disease, which causes a hyperthyroidism. That is, your thyroid starts producing more hormone levels. So the levels of this antibody is sometimes used to get an idea of the severity of your illness, and also it also helps us to decide if it is possible to stop the treatment for your hyperthyroidism, and it has a value to understand the long-term prognosis of the hyperthyroidism and how likely it is to recur again. So the important messages for you are that you must understand your thyroid function tests, and you must know whether you have a hypothyroidism or a hyperthyroidism, and you must understand why you are taking the thyroid tablets. You should not get unnecessarily worried about minor fluctuations in the levels of the TSH or T4 or T3. You must consult your doctor and get the dosages of the tablets adjusted accordingly. If you had an abnormal thyroid test anytime, then you must make sure that you get your thyroid test, especially the TSH, tested once in 6 months to a year, because thyroid related abnormalities are very slowly progressive, and in the when it is mild, it does not cause much symptoms also. And if you have been detected to have high antibodies anytime, then again you must make sure that you're getting the thyroid function tests regularly, at least once in 6 months or once in a year. So some people may have high thyroid antibodies but a normal thyroid function, that is the TSH and T4 and T3 may be normal. So you must remember that there is no proven treatment or supplement or any diet which can help us to reduce the level of these antibodies. Having high antibodies only means that the risk for you to get a hypothyroidism is higher in the future, and you need to keep testing for the TSH at least once in a year. If you like the video and hope you're clear about what your thyroid function tests actually mean. So if you like the video, do like, share and subscribe, and I'll be back with another video very soon.